to the Centers for Disease Control and Prevention, 1 in 3 adults over the age of 65 fall each year. And those falls can mean injuries ranging from bruises to broken bones, head injuries, or maybe even something worse than that. Here to talk about balance in older adults is physical therapist Kristina Oplinger of Mercy Health System's Nazareth Center for PT Rehabilitation and Balance. You know, Kristina, particularly with older people, it seems that balance is an issue and falls can really be very risky for them. Who would be most at risk for a fall?
Anyone older than the age of 65, people who are on 5 or more medications, if you've had a previous history of falls, 3 falls in a year or 1 fall with injury, if you have to use an assistive device like a cane or a walker, that could be a risk for falling. And if you have a fear of falling, you're at a risk for falling.
You know, it's interesting. My mom, who is 87, really is always afraid. She walks so tentatively because she's afraid that she's going to fall, even though she has fallen rarely. But that's really something that, you know, really can create an issue for an older person.
Yes, being afraid to fall will increase your risk for falling. Sometimes being too careful, you can trip and you can fall.
Okay, so you have physical therapies that you use to try to give people a better sense of balance.
Yeah.
Share with us some of those things, because I think that they're really interesting. You don't always think that physical therapy can help in balance.
Right, so balance issues could be due to a number of things. Some of those things could be not being strong enough, not being loose enough, being too tight and needing to stretch. It could be because you don't have enough endurance. It could be because you have another disease such as Parkinson's or multiple sclerosis or neuropathy, so that when you walk, when you stand, your body's not moving how it used to move.
So how much physical therapy is really necessary to be able to make an improvement?
It depends on the person, and it depends on what issues are found. So with physical therapy, we do an evaluation, and we see what are the impairments, what does somebody need help with. If you only have a couple of things, you might not need a lot of physical therapy. If you have a number of things, you might need more physical therapy. So it's different for everybody, and that's why a physical therapist does an individualized evaluation.
And so you brought along some tools, which I think are really interesting. A lot of these are kind of familiar to many of us. So, you know, let's stand up here and take a look at this. You know, obviously this is a cane, you know, but there's really a way to use a cane, isn't there?
There is a way to use a cane, and not all physical therapists, we don't all like all canes out there. So this is a cane I like in particular, and I like to show patients how to use it correctly, because they may use it on the wrong side. It might not be the right height. Those things do matter.
Okay, so you also have a walker, and I've, you know, watched again in my mom's senior community a number of people, you know, who use these. I call them like they're, you know, they're superstar cars.
Yes.
You know, but you also have to know how to use that.
You do. A lot of people tend to use them wrong, especially when they're going to sit in a chair or stand up. And if you're not right, you can fall, and we want to avoid falls as we're speaking.
Indeed. Okay. And then also some other assistive devices, and I think this is interesting too. Now, this would be a grabber?
Yes. So it has a trigger and it can grab things. So if you drop something on the floor, instead of reaching down and losing your balance forward, you can reach down and grab it. Or if something's on a high shelf, instead of standing on a chair and, you know, maybe falling backwards because you shouldn't be standing on a chair, you can reach up and grab it.
Okay. Also, and then with putting on your shoes, that really makes a big difference too, to have a shoehorn, a long one.
Yes, this is a long one, so you don't have to reach down quite as far. So it helps to put your shoe on when the back gets stuck.
Right, exactly. And then, you know, if you have, if you're able to find your balance again, you can always use the cane for a little dance routine.
Yes, of course.
Thank you very much. So for more on Nazareth Center for Physical Therapy, Rehabilitation, and Balance, you can go to cbsphilly.com/talkphilly. Now, here is your